Firstly, I would like to acknowledge the traditional custodians of the land on which we are meeting today. I pay my respects to their elders, past, present and emerging. Good afternoon, everyone. It gives me great pleasure to welcome you to the first webinar series in the VHA Catalyst for Change series. My name is Melanie Fuller and I'm the Director of Member Services and Strategic Partnerships at the Victorian Healthcare Association. This series of webinars has been designed to support healthcare organisations manage change as they transition in the NDIS. Throughout these webinars, we will explore the change framework and playbook for change for the NDIS transition, which has been co-created by the VHA and the Business of Health. Hopefully, you all have a copy of the playbook. If not, it has been shared with your CEOs and comms teams and is also available on the VHA website. In our Wire portal, as well, recorded versions of these webinars. I would like to acknowledge the generous support of the Department of Health and Human Services in funding this work throughout the NDIS Transition Support Package Program. We all know of the enormous reform that the sector has moved through as we transition to the NDIS, not to mention reform taking place in other areas, including in aged care. We have developed the playbook and designed the webinar series in response to an identified need. We have heard that as health professionals, we're not always change experts, and so this framework and supporting webinars are designed to help you implement what are significant changes in your organisations. The great news is that while this playbook focuses on the NDIS, it can be applied to any change. With me today is Claire Edwards, author of the playbook and the change expert, who will guide us through this series of webinars. Claire lives and breathes healthcare transformation. She has spent the last 2 decades working through the public sector, health and community services organisations, private practice and healthcare membership organisations. Claire combines best practice research and evidence-based methodologies to get serious results. As outlined on your screens, there will be an opportunity to ask questions at the end of the webinar, but for now, please welcome Claire Edwards with Webinar 1, Introducing the Playbook for Change.
Hi, everyone. Thank you very much for that introduction, Melanie. And it's really quite exciting to be here today and to be sharing this opportunity with you, I guess. The Playbook for Change has now been distributed, as I understand, to everybody, and you should be able to access it. And the intent behind establishing the Playbook, and I think it was very forward-thinking of VHA when we came up with this idea, was really in recognition that you are the experts in what's happening in relation to NDIS. You understand what the changes mean. You understand what change your organisations may need to be going through. And it's never a matter of not understanding what the change is, but for so many people, it's about understanding how to enable and how to initiate change and how to lead change on behalf of their organisation that we're not trained in, we're not skilled in, and find really difficult, because quite often what we find is it's the content area experts that are tapped on the shoulder by someone in the executive or a board member or a CEO of an organisation. And it's those individuals that are asked to lead change on behalf of the organisation when they may be better off being a participant in the change process because of their content knowledge and expertise rather than their expertise in leading change. And so in recognition of this, what we came up with was essentially how do you lead change as a facilitator, as a coach, as a leader of change, rather than taking it from the position of you needing to be a change expert. And so this concept of learning about change and the process of change actually isn't a new one. There's a behavioural expert in America who works at Stanford University, Professor B.J. Fogg, and he spent over 10 years teaching people how to change various aspects of their behaviour. And what he learned in that initial 10-year period was he was focused on each behaviour that an individual wanted to change, be it that they wanted to lose weight, exercise more, meditate more, be a better family member, a whole range of changes. And he was focused so much on the content of the change that what he learned over that 10-year period was if he taught people the process of behaviour change, the results were much more longer lasting. And in fact, people were able to not only change one behaviour, but were able to change multiple behaviours. And with each behaviour that they changed, they were able to do it faster, more successfully, and in fact invest less energy, effort and resource in making those changes. So it's this notion and this concept of if you can learn the process of change, in fact change in and of itself becomes easier. And so this playbook is very much so, it's not the panacea to all your woes and troubles in the space of change, but it's very much based upon teaching you the process of change, how you can facilitate change within your organisation. Because I strongly believe that everyone at some point in time is going to have to initiate or lead change within an organisation. And I think healthcare, given the massive amount of reforms that are going on, whether it be, as we heard from Melanie, NDIS related, maybe it's aged care reform, plus clinical changes, process changes, system changes, legislative, regulatory, funding envelope changes, you name it, there is a range and raft of change that your organisation is facing. And you need as many people on the ground skilled up in the process of change, not just in the content of what those changes mean. And I think what I've found in my time is I was getting engaged by a number of healthcare organisations and a number of private practices, particularly during this period of significant reform, to come in and help them work on a specific change or to help them find their direction or decide which way they needed to go with change, which is a great, I really enjoyed that work, and it's very much what I would say is a traditional consulting model. Coming in, providing a level of expertise, facilitating an organisation or individuals through a process to achieve an outcome. And what I realised was I was getting called back into these organisations time and time again to facilitate the same process, but just with different content. So it might have been to facilitate a process, to look at the intake process associated with NDIS clients, or it could have been I was brought in to review a program that was being delivered, or an array of services that were being delivered to NDIS clients. And what I found was I kept on doing the same work. I was doing the same work with different content, and therefore it was delivering a different output. And what that made me realise is I needed to be teaching people the process of change, because once you've learnt the process of change, you're in fact able to deal with any change, irrespective of its size, its scale, or its scope. So many of you at the moment are faced with some sort of change. Now, you might be in the midst of a change process, you might be just about to start out a change process, or potentially you're at the stage of evaluating something that you've already implemented and trying to understand, does more work need to be done, or are there any further changes required? The beauty of the framework, and I've called it the leading change model, is that irrespective of where you are in a change process, you can in fact slot it into the model so you know what happens next. So the framework for change that we use is the leading change model, and it has 3 components. The first part is direction. It's understanding where the organisation is, where it wants to get to, and therefore what are the high level things that it might need to do to get it there. And that's where we look at the current state of the organisation, we look at the future state that's desired, and we work out what's the difference between the current state and the future state, and therefore we can determine the transition state. Many organisations don't spend enough time in this space. I often find that they don't understand their current state well enough. Because when we're told or instructed to lead a particular change, our mindset has already moved into the future state. Well, what might that look like? What are we going to need to be doing? Who's going to be doing what? What's the scope of it? What are the outcomes we'd like to achieve? And particularly in healthcare, we're always looking for solutions. It's the nature of healthcare. It's whether you're a nurse working with patients or a doctor, you're looking for the solution to a problem quite often. And so it's really easy to move straight into that future state without actually really knowing where you are. So direction is the first part of the leading change model. It's getting a really good grasp on your current state. What's happening? What data have we got? What information can we gather? How well do we know it? And do we all have a shared perspective on that current state? And making sure everybody agrees with where you're at, because once you've decided where you're going, that gives you an idea of how big the gap is that you need to fill. And so for some organisations, once they know what their current state is, and then they look at what their future state is, it's a small gap, and therefore it's not as big a change that might be required. But if you're an organisation that hasn't been adapting and hasn't had a change process embedded in the organisation where you undertake change on a regular basis, where you've actually only been undertaking changes, these one-off projects here and there, what you in fact might find is that gap between where you are currently and where you need to be is actually quite large. And therefore that transition state is going to feel potentially overwhelming. But if you don't know where you are and you don't know where you're trying to head to, it's really hard to work out what you need to do in between. Which leads into the second part of the model, which is about implementation. Implementation is in fact about not the future state, but about taking all of those things in the transition plan and breaking them down into individual activities so that you know what you're doing is the right thing to elicit the change that you want to see for the future. So what we do is we have 3 loops that we look at in implementation. The infinity loop, which is looking at how you design change. The impact loop, which is actually looking about how do you change individuals' beliefs, because if you don't change an individual's beliefs, you won't be able to do the last loop, which is the influence loop. You won't be able to change their behaviour. And for anything to change, people need to start behaving differently. That's the whole premise and the whole point behind change. And so what this model looks to do is knowing how difficult behaviour change is, and we can't get away from behaviour change and we can't get away from belief change. We do have to do those in any change process. What this model tries to do is how do you design the environment, the situation, the circumstances that in fact encourage and elicit the types of behaviour that you want to see from people into the future. And so what we do is we focus on the environment, the situation, designing the changes that you're trying to do so that you can then have the impact that you're looking to have, which means you're only shifting people's beliefs a little bit. And the behaviour change that you need from people is only a small behaviour change. So there's the 3 loops, the influence loop, the impact loop, and the infinity loop that guides our implementation process. Within each of those loops, there are a number of steps, and each of those steps has been spelt out. The final part of the framework is actually what I think the most important part, and it's a little bit like selling ice to Eskimos, this element, because this is the translation part. This is actually about you building your capability, your capacity, your skills as a leader of change. So this is investing in your own personal and professional development to lead change on behalf of your organisation. The first 2 elements are about the change which is external to you, but this is about your capacity to not participate in change, but to facilitate change and bring other people along in the change process. And to do that, you need to build your own skills. And the 3 parts of building your skills are instruction, application, and meaning. And what we know when we're building skills and we're building our capability around change is that Under instruction, we need to do what are called micro-learning opportunities. We need to look for opportunities where we've got 2 to 3 minutes where we can actually deploy or use a skill or a tool that exists within the framework to build our change capability. The application part is where you're actually looking for bigger opportunities, not necessarily attached to the specific thing that you're trying to change. This is where you might be applying something in a meeting or in another context to see how things work. You're kind of testing the tools that are within the playbook. You're testing the thinking and the theory of the playbook in a setting that is not the specific change that you're trying to lead. And in the last part, meaning, that's actually where you're applying the tools, the process, the methodology, and the model specifically to the change that you're leading. So this framework has 3 components. 1, setting a really clear direction. 2, really harnessing in and focusing in on all the elements that elicit successful implementation of change. And the 3rd part, translation, really focusing in on you learning and you knowing how to coach people through change, facilitate change, and lead change. And that, in a nutshell, is the whole framework. Over the next 3 weeks, we'll be taking a much deeper dive into each of those 3 elements. But now I want to talk a little bit about how to use the playbook. So essentially, a playbook is no different to what an NFL coach might use on the sidelines. There's a whole series of plays that they have for their team to be successful, depending on what they come up against. And essentially, this is how the playbook is configured. Now, within the playbook, like anything, there's a set of rules. So these are 8 rules that will help you when you're facilitating change get the most out of people who are participating in the change process. So these rules are there to help guide you and give you the right frame of mind when undertaking the plays or using the tools within the playbook. The way the playbook is structured is that it's broken down into the 3 sections of the framework. So the first part of the playbook focuses on direction. And what I've done is I've provided you with the simplest and the clearest and the most basic template and tool to use in each step of implementing the framework. And the framework is implemented sequentially. So you start with current state, you move to future state, you look at transition state. That means you've completed the direction piece of work. And there are tools that sit within each of those states that enable you to get the right output to use as the input for the next part of the process. Similarly, with the implementation process, we go through all of the steps in the infinity loop, all the steps in the impact loop, all the steps in the influence loop. They are also all set up sequentially. And each of the tools are set up in a way that means you understand the approach that you're trying to use. You understand if you've got 10 participants, 20 participants, how to actually facilitate a session. So how do you run the session? When do you get people to complete different components of the template? Also within the playbook, we've provided you with blank copies of the template as well as populated copies. So you can see what kind of content would be populated into each space within a template. Along with that, we've given you detailed descriptors of each of the headings that exist within a template as well. So we've explained what sort of content you'd be looking for to go into each part of the template. So essentially, this is a step-by-step process for you to be able to follow to implement any change within your organisation, irrespective of the size, scale or scope. And the way in which these plays have been set up, we've also provided you with a series of additional resources that you can access through the links that if you were to run a one-day session, how much of the playbook could you get through in a one-day session? And it tells you which tools you'd be using, how you'd set up that session, how much time you'd allocate for participants to undertake the work. It also explains additional resources that you might bring along to help people get that work done. So we've provided you with one-day agendas, multi-day agendas, and as I said, an array of additional resources to help you facilitate this process. Now, as you become more skilled, this, as I said at the start, this isn't the panacea for all of change. And some of your organisations may have been implementing things like lean methodology or agile, or using other change management tools. Now, this does not supersede them, but it provides you with the opportunity to include and integrate those tools at different parts, at different stages, or within different parts of the framework. And you'll learn to do that over time. So this playbook is Playbook version 101 for you to be able to facilitate, coach people and lead change within your organisation, irrespective of that size, scale or scope of change. And the reason that we've set this up in such a simple way that you can go through and go step by step, or if you're midway through a process, you might be midway through implementation and you haven't in fact done a current state analysis, you haven't worked out what your future state, and therefore you're not too sure if the change that you're working on is the right change that you need to be working on. You can pause your projects that you're working on and retrospectively go back and input information in to validate the work that you're currently doing. So this framework, you can, if you're starting off a change process, I would encourage you to do every step and use it sequentially. If you're in the midst of a change process, I'd encourage you to identify where are you in that change process and retrospectively undertake the activities to see if you're in fact working on and implementing the right change, or where you may come up against possible barriers or problems in the future, by being able to identify those and then mitigate them through the back end of your project and the work that you're doing. I'd also encourage you to look at the translation component to see where are your skills. So what kind of change capability do you currently have? Are you leading change on behalf of your organisation because you are the content expert rather than the change expert? And if that is the case, how do you start now building your capability around coaching, facilitating and leading change on behalf of your organisation? And this playbook is but one tool, along with this webinar series, that will provide you with some of those learning opportunities. It'll provide you with a chance to stop and think about what is it that you have done, what is it that you haven't done, what might you have missed. And feedback already in relation to the playbook is, whilst it has been designed for their NDIS transition, there are individuals who are reading it, looking at the tools, seeing the plays and going, this is just as applicable to aged care. This is just as applicable to what we're trying to do in our acute service. So the applicability of this and the framework itself can be used in multiple settings. So irrespective of the size or scale of your organisation, you can still be using this change framework to assist you to facilitate change moving forward. I think as I said, it isn't the answer to everything, but I have really tried to strip back and simplify what we've traditionally known as change management. And I think no longer can organisations rely on change management, they need change leadership. And change leadership needs to be throughout an organisation. Everyone working in healthcare at this point in time needs to be an agent of change. There is so much change going on. There is so many reforms, legislative changes, regulatory changes, funding envelope changes, workforce changes, that everybody needs to be building their capability and capacity to facilitate change, because at any point in time, you could be asked to lead change on behalf of your organisation. And this playbook, as I said, is kind of your version 101. It's your cheat sheet. It's your go-to that you can flick through and go, oh, this is what I'm being asked to do. This is where we're up to. If a change project is handed over to you, you'll be able to work out what has been done, what hasn't been done, where there are risks that can be mitigated. And by having a framework for change and seeing change as a process that's always going to be happening within your organisation. So NDIS transition is but one change that's happening in your organisation at this point in time. There are going to continue to be changes and adaptations that your organisation needs to make to ensure that it can thrive and survive in the 21st century. And if you're able to have the change capability and capacity to support your organisation through those transitions, to facilitate change on behalf of your organisation, I think you're going to be in a much better position than if, as I see with so many organisations, they put their head in the sand, they hope that the change just rushes over them and is gone. So I think the real challenge for many of you is the ability to be able to adapt to the changing conditions that are happening and the changing expectations that are occurring on multiple fronts simultaneously. And I think this model provides a structure for you to be able to do that. Now, I could talk about the change framework and the content of it and how it could be applied in your organisation for a lot longer, but what I'm going to do is I'm going to head over to the question and answer section to see if there are any questions that any of the participants have. And I would encourage you to ask any questions, because I know that for some of you, this will be a new space. For others of you, you'll have some experience and expertise in managing change on behalf of your organisations. Some of you might have more specific questions about what would you do in this scenario, or how can I use the playbook in this way. But I would encourage you to start working through it. So I've got a question here that says, if we've started a project, is it worthwhile going back and working through the playbook? And I would say definitely. I think you don't need to go back and do it as a huge collaborative process, which is what I would encourage if you were starting change. Make sure any change that you're initiating, everybody that's affected by that change participates in the change process. But I think if you're already midway through implementing a change, I think it's important for you to pause, take the time to go back, and if you're the person leading the change, you'll be able to populate the templates and the tools really, really fast. So you'll be able to work through what changes need to be made. You'll be able to populate the template. You'll be able to see where you've hit the mark, where you've missed the mark. You can also then use those templates to generate conversations with other people to see, have you got it quite right? And I think this is the thing that some people struggle with, and particularly in health, I see it quite often, that there's so much build-up to a change process and so much attachment to it that people are implementing the change and they're working on change, and it's not in fact having the desired outcome or effect that it should. But what people are able to do is go, have we worked on that change? Yep. Have we implemented that project? Yep. It's kind of seen as a tick box exercise. And I think that's, it's habitual in health, that it's about completing the project rather than what was the change that we were trying to elicit, and has this thing that we're implementing, has this change that we're implementing in fact affected the right outcomes? And if it hasn't, you need to stop doing that. So often we hear that people are feeling overwhelmed, there's so much work going on, people are just really time poor and too busy to take on anything new. And I think that's because so many organisations are busy doing what I call stuff. They're working on things that are not adding value to their clients, that are not adding value to the organisation, or are not adding value to the ecosystem in which they exist. And if you're not adding value, you are just contributing to the noise and you're overwhelming your staff. So I would say it's definitely worthwhile for any change project to pause. One of the things that I didn't mention as part of the process is with implementation, I would encourage an organisation to be implementing a change every 90 days. And so this framework is built off of a 90-day cycle that essentially you can get through the direction, you can get through the infinity impact and influence loop, all within 90 days, and be evaluating the effectiveness of that change within 90 days so that you can make a faster, smarter decision as to whether or not you should continue to be implementing that change. So I think, if you've started the project, go back, look at the tools in the playbook, work through them really quickly up until the point that your project is at, and then take the time to use the remaining tools for the rest of the implementation of the project. Another question is do you need to do all the plays at once? I think if you are starting out and you do not have a background in change management or a background in change methodology, I would encourage you to use each play and do it step by step. If you do, however, have some change management background, some change capability and capacity, you may find that you can pick and choose different tools and resources to use. You might also find that you can add in your own tools, like you'll have particular tools that you're already using, or you'll have particular resources that you're already using that you can integrate in with this framework. Do that. But I would say if you're starting out, yes, follow each of the plays sequentially and use each of the plays within the playbook to get the best outcome. One of the things I mentioned in the playbook is your output is somebody else's input. And so if you're skipping through plays or not generating the best output, that's going to compromise the input for the next part of the process. And so we don't want the process compromised at any point in time. We want it to be as thorough and successful as possible. And I think this is the thing, when people look at the framework, it can feel a little overwhelming, but essentially you can get through the direction and the first part of the infinity loop within one day. And I talk about essentially that first part can take a maximum of 12 hours. Now, if you haven't got it completed within 12 hours, so that could be broken into 2-hour lots, it could be broken into 2 6-hour days. If you haven't got through direction and the first component of implementation within 12 hours, this change is not a priority for your organisation. So 12 hours to do the first part, 90 days to go through the full process. And it is really about getting people to take action. So getting people to act. And I think so often we look for clarity and we're searching for a level of clarity which we then believe will motivate us to then take action, when in fact it happens the opposite way around. If we take action, action provides us with clarity. And it provides us with the clarity to either continue doing something or to stop doing something. So that's the motivation part that happens after that. So it's action, gives us clarity, provides us with motivation to keep going. And this is what this model is trying to do. It's trying to get organisations to act faster, to be really clear about their decision making, to make more decisions more frequently based on information, evidence, data, based on the actions that they're taking rather than based on the assumptions that they're making. So I'll say that again. We want organisations taking action faster based on the data and the information that comes from their actions rather than them making a whole series of assumptions before they take action, because we often find that that's not quite correct. One of the questions that's been asked here is, does it matter if we're not a huge organisation? So no, it doesn't matter about the size of the organisation. I work with private practice where a practice manager who may be responsible for 2 or 3 admin people, and they may have 3 or 4 clinicians working within a practice. They use this framework. I've worked with private healthcare business owners who have used this framework. So it doesn't matter about the size of the organisation. It's actually about just doing the work. It's about getting the action happening. And as I said, model works on a 90-day cycle. So if you think about a 90-day cycle, that means an organisation is implementing 4 changes, or an individual can lead 4 changes on behalf of an organisation. Too often we make change so big and we're implementing so many changes concurrently that in fact we don't implement anything well at all, and we see the rates of change failure increase and increase and increase, and we see staff become more and more cynical about the change process. So this is designed for a one-man organisation or a 1,000-person organisation to be able to use. So this model has been tested not only in the healthcare environment, but it's also been tested in a range of other service-based industries, plus product-based industries. So it works for service development, it works for product development, it works whether you're looking at strategic development for the organisation. So if you're undertaking a strategic planning process, or you're looking at a specific operational change, or you're looking at clinical change. So this model has also been used to develop new models of care in the cancer services space. So there's a range of industry sectors, sizes of organisations, skills, capability and capacity of individuals who have all used this framework and have all found that the tools that have been included within the framework are the simplest tools for individuals to use. They're really intuitive, they're relatively simple, and it is a very much paint by number kind of exercise, so that you know what you need to do, and then you can tweak and adjust it based on the type of change that you're leading. You can tweak and adjust the tools based on the individuals that might be in the room, based on your own facilitation style, all of those sorts of things. So it's a very flexible and adaptable model as well. And I often say a model is useful until it's not. So whilst this is useful and whilst this is helping build your change management capability, once it's no longer useful, don't continue to use it. Use another tool, or potentially use this as a framework and insert different tools in other than the ones that have been suggested within the playbook. Another question here is, what would you tell a leader who doesn't think we need to plan for our change? That's a really interesting one, because often what we see, particularly with change management, is that change comes from the top, or change when organisations, particularly in healthcare, some organisations will wait till the last moment before implementing an externally enforced change, if you like. And I think the leaders who wait till that last moment, and this is why I think within an organisation, everybody can be a catalyst for change. Irrespective of whether a leader thinks you should or shouldn't change, change will happen. And the reason that I say this is we just need to look to nature to see that there is always a current state, there's always a future state, and there's always this transition state. So even if an organisation is choosing not to change from its current state, it's in fact determining that that is going to be its future state. And there will be changes that happen because staff will become more skilled within their role. Staff may move on from the organisation because the leader isn't willing to change. So there's going to be these changes that might sit around a specific change that you think you need to plan for, that in fact force an organisation's hand. And I think my experience with NDIS is seeing that. I've seen many local government areas, I've worked with many organisations who have in some ways denied that NDIS is actually a thing, that it's really going to stay around, that, I've seen changes like this with the Commonwealth before, we'll go back to block funding before we know it, and the world will be familiar once again. So I've seen organisations in that situation where their leaders aren't thinking that they need to change. There's uncertainty about what should change, and is this change sticking around, and they don't want to be a leader in the space. And I think the impact of a leader not wanting to change. What happens is if you've got a leader that's willing to change, you've got your current state and your future state, and they're quite close, meaning any change that needs to occur within the organisation, within that transition state, is really small. So as your organisation's continuing to evolve and change, if you've got strong leadership, it's kind of keeping pace with the future state. Where you have a leader who doesn't think you need to change, what happens is the future state starts to drift further and further apart until they are forced to change. And then when they are forced to change, the gap between the current state and where they need to be can feel like a chasm. And you still have to do all the same changes that organisation who was kind of tracking with their current state and future state has to make. It's just you need to do it in a shorter period of time, and it's a bigger change that needs to occur. And I think this is where we see organisations who end up with changes in board, changes in management, significant turnover in staff, poor client retention, poor client acquisition, all of these sorts of things. You see a whole range and raft of problems that an organisation's having when they actually allow that drift to occur. And this is part of my motivation behind doing this framework is I'm trying to help healthcare transform because it needs to transform. It's being forced externally to transform. Internally, it's also being forced to transform. And the closer you are to continually looking at any change that you need to make, the easier that change is going to be. The greater that gap, the longer you wait, the more overwhelming it's going to be, the more likelihood of your organisation not surviving and not thriving and not being around. And I think we're starting to see that more frequently in terms of organisations either being bought out by other organisations, entities folding, bankruptcy, a whole range of issues in healthcare where that drift has just got too far and the gap feels too big to broach. And quite often that comes down to a leader not wanting to make change when change is really necessary and needed. Another question here is, can you involve the board in this change process? Definitely. I would be involving the board, I'd be involving consumers, clients. I'm a really big believer that you need, in any change process, multiple perspectives in the room, because those multiple perspectives are going to give you insights into things that you wouldn't normally think about or wouldn't normally see within your own personal worldview. We all have a way in which we look at things, a way in which we are predisposed to do things, and that's structured around our own personal beliefs and behaviours. By involving the board in a change process, you really need them to set that scene around the direction. You need a board to give the authorising environment to say, yes, this is a space where we need to change, and yep, we agree that is what success looks like. And I think this is one of the big things that we'll talk about next week in the direction piece, is around measures of success. Organisations, I find, aren't very good at setting these goals to say, well, what would look different? So we use heaps of fluffy words and all these sorts of things, but what would tangibly be different as a result of all the investment that we're making? And I think if you were to ask many boards, particularly if you're looking at some strategic changes in an organisation, if you said, okay, well, what's the current state? What does our community look like now? What do we want our community to look like in the future? From the investment that we're making, how well are we doing? And I think when you don't include the board in a change process, their understanding and their view of the current state of the organisation and what the desired future state can be a bit skewed. So I think it's really critically important. Yeah, include the board in the change process. Include as many people, or anybody that is going to be impacted or affected by the change needs to have the opportunity to participate. And there's different stages at which people can participate. And I think it's about being really transparent and being really clear about what a person's participation is contributing to, what it might look like, where contribution can be made, but just because I'm contributing doesn't mean that I get the final say. There may be decision makers that need to be involved. So being clear about the type of engagement, the level of engagement with people in the change process, I think is really, really beneficial. And, you know, I often, in the current state, one of the tools that you use is the client journey map. And obviously we can all put ourselves into a persona of a client, but there's nothing better than actually asking clients yourself, going, well, what happened? And what questions did you have? And what were you trying to achieve by taking that action? What was the output you were looking for, or the outcome you were looking for? And how did that make you feel? You know, I think involving people who have the knowledge and the expertise, and, you know, involving staff who work on the ground. You know, it's one thing to look at policy documents and procedure documents and they'll say one thing, but start to talk to people who are actually doing this stuff day in, day out. And I can guarantee you the processes don't look the same. And therefore the problems aren't going to be the same, and therefore the solutions you need to generate, the things that you need to change, you might be changing the wrong thing. And so this is where I would say involve everyone, but yes, definitely involve the board in the change process. And, you know, it's a simple enough playbook that I think the board could read certain sections of it and say, is this for our organisation or not? Does this feel like a good framework for us to be implementing change? And, you know, I think also with the national standards, there's a requirement for you to, you know, as part of standard 2, you need to involve consumers within your change process, within your strategic planning processes. And I think this gives you a really nice framework to include clients and consumers in the change process, to include board members in the change process, for them to get a different level of understanding about really what's going on in the organisation, what needs to happen, and where it is that time, energy and effort needs to be invested for the greatest amount of change, or for the best change for clients, for the organisation, and at an ecosystem level. Now, I think there's one more question that I haven't answered here, which is, where do you think is the most important part of the process to focus effort? Now, there isn't one part of the process that I think more effort needs to go into. I think there needs to be applied effort throughout the process. And one of the things that I identify is, you know, when a project starts, there's almost like 20% of our energy and efforts invested, when in fact in the middle part of the process, the implementation part needs 70%, and then we still need 10% as the projects, or as the change is coming to an evaluation and before it kicks off for its next iteration and stage. I think in terms of where, or the most important thing is that everybody has a shared view of the current state. And when I work with organisations, so when I'm facilitating this process on behalf of organisations, current state analysis is always the most alarming for me. And the reason that it's most alarming is it surprises me, and it probably shouldn't at this point in time because I've done it so often, how little or how disconnected the information is that individuals know about their organisation or the particular area of change that they might be looking for. In private practice, it's about their business, how little they actually know about their business elements and how the business connects to service delivery and those sorts of things. The depth and the level of understanding of the current state is always extremely light on. And it is quite telling when you start to actually do the current state analysis that organisations often think they're further ahead than they actually might be. And it's when you, one of the things that I talk about in the book is the importance of creating artifacts. And artifacts aren't a report is an artifact, but it's not a meaningful artifact in many ways, because some people will thumb through an executive summary and that's as far as they'll get in a report. So the way I've structured the templates is so that they can be used as visual artifacts that can be pinned up and posted on a wall for people to look at, agree with, write on, contribute more to, reflect on. And it's always at that current state analysis. I've recently undertaken a review for an organisation where we've looked at their current state. They wanted to know what they could do to improve some operational efficiencies, and also financial efficiencies. So they were coming at this going, right, we want to look at operational efficiencies and financial efficiencies, and we want some ideas and recommendations about what we should do into the future. And, in this transition state, how do we get from where we are to where we want to be? And what are the most important things for us to focus on to enable that transition? What I unpacked as part of doing their current state analysis was less about the issues that they'd felt financially or the issues that they'd felt operationally, and in fact found a whole raft of quality and risk issues that they were completely unaware of. And yet quality and risk were two of the things that were extremely high on their agenda, and going, yep, we deliver a higher quality service. We've mitigated all of our risks. We've got these new systems in place that mean our financial risks are completely being managed. And through me doing a current state analysis, what I was actually able to find was people had found ways around the system to still undertake financially fraudulent activity. People had manipulated the quality standards to suit themselves and were in blatant breach of quality processes, a whole range of reviewing and checking and a whole series of things associated with quality. And so essentially a review that was about how do we have some operational efficiencies and better financial efficiencies turned into a situation where the organisation was considering whether or not they could mitigate the level of risks that they were exposed to and mitigate the level of financial fraud that they were being exposed to in fact even continue delivering a service. And so it's moments like that where I kind of go, how well do you know what it is that you're already doing? Because your current state is in fact the only thing that you can know really, really well, because it's already happened, it's already there. And so that's always the part. And I think if you can get your current state analysis done well, I think the rest of the process becomes much easier, because you're really clear that you're working on the right things, you get really clear about the kinds of change that you want to implement, and you get much, much clearer on what does success look like in the future. And by moving through the framework, I think you end up with a better result. If you get that current state, if you start off really well, I think it changes what then happens in the balance of the process. If you don't do current state well, I think it just taints the rest of the process, and you potentially will find yourself doing things that you don't necessarily need to be doing. Now, I'm mindful that I've done a whole lot of talking, and thank you to everybody who's contributed questions this evening. I recognise that some of you might want to go away, have a bit more of a look at the playbook, a bit more of a think about the change that you're about to lead or that you're in the midst of leading, and further questions may come up for you. Plus, also those of you who are listening to this as a recording may go, oh, if I was listening to that, I really wanted to ask this question, or I wanted to understand this a little bit more. So if you do have any further questions, I'm happy for you to email me. And the email address that you need to send your questions to is hello, HELLO, at Claire, CLAIRE -Edwards, EDWARDS.com. And those email details are also in the appendix of the playbook as well, so you can access those there if you didn't get a chance to write that down. Now, with that all done, I'm going to hand back to Mel.
I would like to thank all of you for your time today and thank Claire for taking the time to share her knowledge, insights and experiences. As I mentioned, a recording of this webinar will be made available on the VHA website, which you can use as a reference tool should you wish to revisit content from this session. Also, if you would like to join in any of the remaining webinars in the series, you can register for these on the VHA website. Webinar 2, Setting Your Direction, will take place at 9 May at 8 AM. Webinar 3, Implementing Change, on 30 May at 12 PM. And Webinar 4, Becoming a Catalyst for Change, will take place on 20 June at 8 AM. Thank you and good evening.